Okay, so this first question that we have is going to be a prioritization type question. So if you were in Amber's webinar last week, this should be an easy question for you, right? Okay, so let's take a look at what we have. We have an emergency room nurse who has received change of shift report on the following clients, and we're being asked, the nurse should first see which of these clients. So this is a prioritization type question. So of course we're going to see all of these clients, but this is asking us which one we should see first. So if we're thinking about who we should see first, immediately to me, I start thinking about who is at the most immediate risk for negative health outcomes if we don't address their situation right away. So before we start looking at our answer options, let's go back to our really helpful prioritization pyramid to remind ourselves what we know about prioritization before we start looking at our answer options. Okay, so if we look at our pyramid, okay, so many of you have probably seen this before. So we're going to start with our least acute issues and work our way down to our highest priority. So the first thing we're going to do is rule out any stable or chronic issues. And so for me, the example that comes to mind would be maybe a client with COPD, and they have dyspnea on exertion. So we know that that's not good, right? We know that COPD is bad news, but dyspnea on exertion, we would expect that, right? Because COPD has caused damage to their lungs, and their lungs are not functioning like we would expect in a healthy person. So if they're having dyspnea on exertion, that's kind of a chronic issue. It's a stable issue with COPD. We expect that to be there. And so if they're experiencing dyspnea on exertion, chances are that's not going to be an immediate issue within the next 5 or 10 minutes, right? They've had this going on for a long time. It's probably going to continue for a long time. Okay, so from there, we can start ruling out routine tasks, expected findings like this, and psychosocial needs. So we might see distractors like maybe a client who recently lost a job. Maybe they're having like financial stressors, which we're not saying that those aren't important. Yes, these are very, very distressing for a client, but they're not going to pose an imminent risk to their health within the next 5 or 10 minutes, right? So we're going to say that that's a lower priority when we're looking at the grand scheme of things. And then from there, we can go to our neurological disabilities, circulation, and breathing, right? We're getting to things that are a little bit more imminent. And then our two big ones, anything to do with airway or safety. And this makes sense, right? So if we have a client who has an obstructed airway, how long do we have to intervene? Not very long, right? Probably seconds, right? Before this becomes a health or a life-threatening issue, whereas, financial stressors are not going to be life-threatening within the next few seconds, right? Like an airway issue would be. And then safety. So anything that poses an imminent safety risk to the client, like active suicidal ideation that they plan on acting on, right? That's going to be an imminent risk very quickly, okay? So let's go back to our question and see if we can figure out which is the highest priority, or who are we going to see first. And I see a lot of you are commenting already in the section of what you think your correct answer is. So let's see. So our first option is a 7-year-old who fell out of a tree and is cradling a discolored and swollen arm. What do you think might be happening here? This maybe is a sprain or a fracture maybe. So it's a localized, right? So we have nothing to indicate an airway, breathing, circulation issue or an imminent safety concern. So definitely we need to address this, right? Because they may have a fracture. So we need to do something about it, but is it our highest priority? I'm thinking probably not, but let's see what else we have going on. So our next option is a 3-year-old who's been vomiting for 12 hours and has a temp of 103. Well, already this is more concerning to me, because if they're vomiting and they have a temperature, what are you worried about? I'm thinking dehydration, right? And that could be a circulatory issue, right? If we have low fluid volume. So already I feel like number 2 is more of a concern than number 1, right? So I'm going to eliminate number 1. So let's see what number 3 is. We have an 18-month-old who's vomiting and was found with an open bottle of drain cleaner. Okay, what are we worried about here? So if they're vomiting, they have an open bottle of drain cleaner, I'm worried they have ingested this drain cleaner. And what do we know about drain cleaner? It's corrosive, it's toxic, it's nasty stuff, right? It's probably going to cause tissue damage. So if they swallowed that and they have this chemical in their throat causing tissue damage and inflammation to their esophagus, what's right next to their esophagus? Their airway, right? So now we have swelling and inflammation and corrosive chemicals around the airway. That makes me worried that we could have an airway issue very, very quickly. And we'll remember that airway is going to be our highest priority. So circulatory issues, like we talked about with dehydration, is concerning, but not as high as if we have a potentially swollen and occluded airway, right? So I'm liking 3 over 2, so I'm going to eliminate that one. All right, let's take a look at our fourth option and see if that's any more concerning than this potential airway issue. So we have a 5-year-old with epilepsy who's experiencing a seizure 30 minutes ago, and it lasted 3 minutes. Okay, well, they had the seizure 30 minutes ago, and we're not being told there's anything happening now. Now, if the seizure was longer than 5 minutes, we might start to worry about status epilepticus, right? But it's only 3 minutes, and it seems to have ended, right, because it was 30 minutes ago. So that would fall probably under neurological issues, right? But it's still not higher than airway and safety, right? So I see a lot of you are commenting you like number 3. I like number 3 too, because that is a potential airway issue. So that is going to be our highest priority. Because remember, we're still going to see all of these clients. We're just being asked which one are we going to see first. So I like number 3 also. So should we see if we're right? Yes, you guys got it correct. Good job.